With autism spectrum disorder, the diagnosis does matter. There's been growing dismay about the utility of diagnoses in children's behavioral health. But our data, now replicated in 2 states, appears to reveal an important exception to this belief. A diagnosis of autism spectrum disorder, or ASD, for children and youth who qualify is associated with notable clinical improvement. However, because of a lack of timely detection and an insufficient supply of medical specialists to provide the diagnosis, people with presumptive ASD are not getting interventions that we know can be effective. That's a bad idea. Children and youth who have been in the system often get many diagnoses which change over time. These and other challenges have led to a general distrust of diagnosis. But we know that a diagnosis of autism spectrum disorder does matter. Perhaps one of the reasons why this is that interventions and supports for these children can be dramatically different than those used in the traditional behavioral health system. And once parents and other family members know that their child is dealing with ASD, they are better prepared to accept that child as they are. We need to confirm or rule out this condition as soon as possible if we truly wish to have a system that cares. ASD is a neurodevelopmental disorder. However, since ASD can present as a behavioral health condition, children with ASD are increasingly funneled into intensive community behavioral health systems. In terms of their CANS profile, it's true that children with ASD are more similar to those in the behavioral health system than they are to children with developmental challenges. They actually look like children with ADHD and with notable social and sleep challenges. So CANS profiles can actually be used to predict which children who currently do not have an ASD diagnosis would in fact be eligible for that diagnosis if they were properly assessed. We have demonstrated that once a diagnosis of ASD is confirmed, these children experience improved outcomes on items that distinguish them from other children: social functioning, regulation, impulsivity, interpersonal strengths, and sleep. It appears that the appropriate recognition of ASD helps children better use existing treatments and supports and result in better outcomes. We are creating decision support tools to suggest which children and youth might benefit from a careful diagnosis to determine whether or not they are on the autism spectrum. We need to build better linkage, triage, and communication between the public behavioral health system and the developmental care system, and with experts who are trained in the diagnosis of ASD. Autism spectrum disorder forces us to learn how to collaborate between these 2 sectors because these young people live in between. The evidence is clear. Early diagnosis matters. The sooner we can identify young people who are on the autism spectrum, the better their outcomes will be.